Brain aneurysm is the ballooning of a weakened area in the wall of a blood vessel in the brain, which can cause a leak or rupture, causing bleeding into the brain, also known as hemorrhagic stroke. It often presents no symptoms or health problems until it gets to a stage where the aneurysm demands urgent medical attention. When an aneurysm ruptures, it causes direct damage to surrounding cells, and the bleeding can damage or kill other cells. At this stage, the patient would have experienced sudden severe headaches, stiff neck, loss of consciousness, double vision, sensitivity to light, confusion, seizures, and/or nausea for some time. Risk factors include smoking and severe alcohol intake, high blood pressure, family history with condition, race, and gender. Surviving aneurysm is the story of a few against the many who detect the condition late and pass on, or do not have the resources to undergo treatment, and eventually passing on as well.
I am here in the home of 27-year-old survivor of brain aneurysm, Jennifer Forson. I'm here to interact with her, find out about her condition and how she's lived it through life. Come with me. Hello? Hi.
Hi.
Jennifer Forson collapsed while on set. She used to be an actress, but the unfortunate experience that day ended her dream to pursue acting, forcing her into an unending cycle of hospital visits and eventually an emergency surgery.
I guess last year, I kind of felt stroke in my leg, and I was on the stage performing. And the next thing I see was I was in a hospital. It wasn't easy, so actually they took some water from my back. That's how come they knew that I had a leakage in my head. So we went to do CT scan at Sunlight. Yeah, we went there to do, I think, on 2 occasions. And then the third one, they were like, "Now we have to operate on me."
The ruptured aneurysm, hidden for more than 6 months, caused Jennifer to frequently experience severe headaches and sometimes numbness in her legs.
I had headache for a while, like it's been there. It even affects my tooth sometimes. I had to even use block or something to be okay. It's been there like, I think, 6 months or a year. Yeah, so I've been feeling it, but I don't check. And when it comes, it's like there's 2 holes in your head and you're hitting something on your head. That was how I was feeling it. So I had to even boil hot water and put my face in it on several locations before I'll be fine. It was that massive. I had to cut my hair because I couldn't take it any longer.
Mrs. Doris Osei is also a survivor of brain aneurysm. She tells me her condition was characterized by confusion, coupled with vomiting and blurred vision.
I couldn't stand in the sun like this, like the way I'm standing. No, when I have to close my eyes. And then at one point, I forgot my alphabets. Yes, when I look at it, I see, I knew them, the way they look like, but as to which one is A, B, no, I didn't remember anything. It took some time. I nearly paralyzed.
Dr. Benjamin Dabusa is an interventional radiologist. In 2019, he led a 7-member team of Guinean doctors to perform the first brain surgery to repair aneurysm without cutting the patient's skull.
Beyond the headache, some of them will come with seizures. Okay, they may have seizures. They will also come with aversion for light, we call it photophobia. So when they are in a place where there's light, you see that they are very uncomfortable. Some of them may also have change in behavior. There may be confusion, all sorts of neurological problems as a result of the ruptured brain aneurysm. If they are not ruptured, most times they don't have symptoms at all.
It is estimated that 20% of people who present with brain aneurysm die before they are treated. Of the remaining 80%, about 50% are at the risk of losing their lives if not treated. And of the remainder, if treated late, the aneurysm could leave them paralyzed or with health complications such as brain damage. According to the Brain Aneurysms Foundation in the United States, ruptured brain aneurysm accounts for 3 to 5% of all new strokes. And that brain aneurysms are most prevalent in people aged 35 to 60, but can occur in children as well. Most aneurysms develop after the age of 40. Women are more likely than men to have a brain aneurysm, and blacks are at a higher risk. So for Doris, a black woman, she knew she could lose her life.
Initially, before my treatment, I was scared. I thought I was going to die. I even told my family I want to have a video done, series of videos done for my daughters, so that as they grow, they will see it, I'll be advising them. But my family said no. My doctor said no, because if I had done that, it meant that I would have given up.
After an aneurysm is detected, the patient is presented with the options of treatment. Dr. Sarkodie takes us through the surgical procedure for brain aneurysm.
There are two main types of treatment for brain aneurysm. One of them is surgical, and the other one is what we call endovascular. Endovascular is minimally invasive. That is what I do. We find an artery, normally in the groin, and we are able to pass wires and catheters from the groin all the way up into the brain where the aneurysm is, and do the treatment for it. The treatment involves deployment of certain substances into the aneurysmal sac, or into that balloon that we described, so that blood will no longer flow into the aneurysm. These things that we put inside the aneurysms are quite expensive. We call them coils. They have some property that actually helps to occlude that space so that blood will not come into it again. Mind you, not all aneurysms need treatment. So we normally look at the size. For some people, we'll tell you that we need to monitor the aneurysm over time. And if it is increasing beyond the acceptable levels, we can then do an intervention for such people.
The surgical treatment of the condition is estimated to cost between $20,000 and $30,000. Though an expensive process, Dr. Sarkodie emphasized the need for persons who suffer recurrent headaches to seek medical advice.
We are not saying everybody has brain aneurysm, or anybody who has headache has brain aneurysm. But it is important that when you have certain types of headaches, you seek medical opinion or medical advice, because some of the headaches may be as a result of brain aneurysms. Most of us get headaches once in a while, but if you get a headache that it's so intense that you cannot do anything about it, you don't stay at home. You report to the nearest hospital.
After surviving the procedure, Doris founded the Brain Aneurysm Foundation with the assistance of some people to create awareness and solicit for funds to support others to undergo treatment.
We want people to come and help the Brain Aneurysm Foundation so that we can save lives. It's expensive. It's so expensive that a lot of people cannot afford it. So when they are diagnosed with it, some go home and then they go and die.
The condition is not covered under the National Health Insurance Scheme. Perhaps it is time to open discussions on how the state can help persons with such conditions. While reviews are important after surgeries, Jennifer struggles to make it for her appointment. The financial burden is huge.
I'm even supposed to go for a review that was in March, but after the surgery, a whole lot, so I couldn't afford that kind of money.
How much do you need for the review?
That is almost 5,000, and then some extra expenses and all that's like 2,000 there, so let me say 7,000 is what I need.
It is crucial for one to frequent health facilities, as such conditions are identified as a worst stage due to the common symptoms that comes with it. For Citi News, Bervelyn Longdon.